Welcome back. With holiday gatherings about to, of course, get started, that means it's also, unfortunately, time for a lot of germ spreading.
Seriously, today we're talking about something to look out for, a rise in whooping cough cases. Our 9 News medical expert, Dr. Payal Kohli, joining us. So let's talk about whooping cough, because I think we always associate it with the little ones, but like, what is it?
Yeah.
Sounds pretty rough.
It is rough. It can be rough even for adults, actually. So whooping cough is a respiratory infection caused by a bacteria, Bordetella pertussis, also known as just pertussis. And it's got different phases, actually. So the first couple of weeks is just like a mild cold, and you don't have that classic cough. That's when you're most infectious. And so you may not even know that you have whooping cough. You just think it's a cold or some other virus out there. And then the next kind of after 2 weeks, from 2 to 6 weeks, you get that classic whooping cough. And it's essentially kind of an inhale after you cough. And the coughing is so intense that people often vomit.
That doesn't sound like whooping cough, does it? Okay. Sorry.
We got some water.
I have a cough.
We got some water.
So I didn't hear that whoop. I didn't hear that
Okay,
classic
good.
whoop. But often after a viral infection or bacterial infection, we actually damage the cough receptors in our lungs. So even after the infection has cleared, which is what happens with whooping cough, 6 weeks later or more, you could still have a lot of lingering symptoms of that cough. And as you said, Alex, normally we sort of see it in little babies, infants, or in the very elderly. Those are the people that get super sick with it. But it is certainly something that cases are going up, and so any of us could be prone to.
So you see these headlines, I think it was in California where they saw a big increase in cases just this past week. They're scary headlines. Should we be concerned at this point about that increase?
So I think most of us healthy adults probably not super concerned, except that it puts on our radar that cases are going up. So this sort of really begs the question about, well, why are cases going up, right? And there's a few reasons. So I'm concerned about the fact that it seems like the bacteria has evolved to actually evade vaccination. So that's reason number one. The bacteria is kind of changing a little bit, so the vaccines are not as effective. But two, and even more concerning, is that we had very little vaccination during the COVID pandemic. And you know, we often get our DTaP as kids, and then we're supposed to get a Tdap when we're adolescents to get a little boost, or as adults, and a lot of us have missed either that boost or that initial. And pregnant women are actually supposed to get
I just got it.
Did you get it?
You know, well, a few months ago, yes, when I was pregnant. Yeah, I
and
got
the reason
Tdap.
for that is because little infants and newborns, they can't get the vaccine. So mom actually has to get it to pass on the antibodies to baby right before delivery. So because all of this is petering off, the bacteria is getting worse. And to be honest, most of us have stopped masking when we're sick, which is another thing we have to go back to doing because respiratory virus season is picking up and flu season is picking up. I think that's the reason we're seeing these types of increases.
Is there a way to prevent them if you're around somebody, or is it just staying home? I feel like we've learned so much from COVID and back during the pandemic years that we learned so much about infectious disease and things like that. And you kind of forget about it sometimes, but when you have things like this come back up, you go back to some of those things like masking, right?
So the way that it spreads is person to person, and it's droplets. And because it's number one, highly contagious. So it's actually a very, very contagious illness. And number two, you can imagine when you're doing a whoop and a cough, you're really expelling those respiratory droplets quite a bit. And number three, the tail of infectiousness is really long, which means that when you get it, you can be infectious for several weeks, especially for your child, even after you've kind of cleared and you're feeling a little bit better yourself. So highly contagious, you expel a lot of particles, and you're infectious for a long time. So the combination of those three things makes it so that you really want to have your guard up. Now, if you think your child might have it or you might have it, it's important to get it tested early because there's antibiotics that you can take that can shorten the duration of infectiousness and the symptoms. And again, you want to make sure that you're doing a lot of the respiratory precautions, even around your kids. And I know sometimes it's really hard to mask around the little ones and around our kids, but if you want to protect yourself so that you can be there for your child, it's really very important.
Yeah, we have to do it. Like, we're walking around the house right now in masks. My 4-year-old is sick. She has masks, but we're like, we have to wear a mask around the baby. You know, you got to do what you have to do to keep everybody healthy.
And I'm so glad. And here in Colorado, we've seen an increase in whooping cough too. So it's not just other states, it's not just national, we're seeing it here. So just have your guard up and do the best that you can. But if you haven't been vaccinated or gotten that booster, or your child hasn't, definitely not too late to get it.
That's good.
Okay, good information as always, Dr. Kohli. Thank you so much. And you can always find more with Dr. Kohli at 9news.com/Dr. Kohli.